18th and we are stuck at home because of the coronavirus. As a third-year dental student, I'm supposed to be in clinic full-time with just PBL twice a week for not that long. But of course, I'm still home and it feels really weird because I normally have so much to do. I have nothing to do besides PBL. So it's just different. Especially because I know I'm supposed to be seeing patients. This is the year where I'm supposed to be getting all of my practice, my hands-on practice. Unfortunately, life happened. So I'm drinking my chamomile tea because I've been feeling anxious lately and it helps my stomach. For the first few weeks of quarantine, I was finishing up my second year of dental school. So I was doing online classes and I took all of my finals online. And then we had 2 weeks of spring break. During those 2 weeks of spring break, I was hardcore studying for my national board examination, which got canceled twice. The first time it got canceled, it was supposed to be on May 1st. And then I tried to reschedule and I saw that May 2nd was open. I shouldn't have rescheduled for May 2nd, but I rescheduled for May 2nd. I showed up to the test center because they didn't cancel that appointment. But of course, no one was there. It was canceled. And then after spring break was over, we had a week long of clinic orientation through Zoom. So that kept me busy. And I also had to remediate one of my classes. I had to remediate removable. So I had to study for that exam again. And I had to practice doing or making a denture online. So I was busy doing that last week. Now, this week, I am very free and I don't have much to do. Today I have an Endo Lecture at 10 a.m., so in 30 minutes through Zoom. And then that's all I have. And then on Tuesdays and Thursdays, I have PBL at 3:30 for like an hour or so. And that's literally all I have for the week. I actually have one more other lecture, but it's pre-recorded, so you can watch it at any moment in time. I have my oil diffuser going, and since I have about 15 minutes before I have my next Endo Zoom lecture, I'm about to do a meditation with Headspace. Headspace is just an app, and I have an annual membership because it's only about $10 for students. This app is really cool. It has a bunch of guided meditations. It even has guided meditation where you're walking and you just listen to it and just breathe. I don't know, I think it's helpful, especially if you're like me and get anxious pretty often. It also has Sleepcast. I did one yesterday. I'm going to do, one of my courses is called Letting Go of Stress, so I'm just going to do that for 10 minutes. I'm on session 6, level 1. And it's also really nice doing this with the oil diffuser that we just got.
So welcome back. Now, while some people are quite happy just to do this technique and to listen.
I'm gonna log on. And of course, I'm still gonna have this thing going. Shoot, I'm gonna be late. Here
I don't know much more than you guys know.
is my class.
And I realize, like, yeah. I mean, as soon as I hear everything, I'll definitely let you guys know. And we're just putting our heads together. You know, we'll keep on having this patient has their final restoration. And we don't worry so much if we have a tooth that has a periapical lucency. There's no reason to wait until that's resolved.
All right, so we finished up with that Endo Lecture. It was an endo review to help us refresh our mind about endodontics, so when we start working on our patients, we know what we're doing. Most likely we're still going to be able to practice in the sim lab one more time before we start on real patients. Who knows when that will be? I keep thinking that it's really soon and I'm going to be doing all these things really soon, but to be honest, who knows? We don't know. For the rest of the day, it's about 12 p.m. right now. My fiance is on his way home. He just texted me. We're gonna have chili for lunch, which we already prepped yesterday. Actually, he already made it yesterday. So he's gonna come home for lunch. Highlight of my days every day is having lunch with him. And then he'll go back to work and then it'll be 1 p.m. and then I think I'll probably do some yoga, and then after yoga I'll finish up my learning need, submit my learning need, and then who knows, we'll see. So I took a detour from doing yoga. I was about to set up my mat, and then I remembered that I had to call someone. So I called a dentist, and I kind of wanted to tell you about it because, I don't know, there's not that many exciting things going on, but here is my story. About 2 months ago, I was being seen at the USC dental clinic as a patient because I needed dental work, and I got an inlay prep on tooth 30 on my right side, and I was supposed to come in the next week for my next appointment to get the actual inlay. But COVID-19 happened, and I was never actually able to get my inlay because all the clinics closed. So for the past 2 months, I've had a prep. I originally had a temporary. I had a cavit temporary, and half of it broke after the first week, and then the other half is still there. The mesial portion of my temporary is there. The distal part broke. My dental student who worked on me graduated. I'm super proud of her. She was great, but I no longer have a student dentist anymore. I'm sure I'll get another one. Anyways, I was debating if I should go into the USC dental clinic as an emergency patient and maybe get another temporary, or if I should just wait it out, try to keep it clean, try to not eat on it so it doesn't fracture, all these things that I'm supposed to do. I don't think it's worth getting sick since that is a pretty high possibility. Okay, the reason why I called this dentist, I started getting sensitive on that tooth 1 day ago, but 2 days ago I did a whitening strip, and I think this is where the sensitivity was coming from. So I did a whitening strip 2 days ago because I thought to myself I wasn't going to get my inlay bonded anytime soon, so why not do a whitening strip? The reason why I haven't been whitening my teeth before was because if you're going to get something bonded, so for example a composite or a bonded inlay or a bonded onlay or even a bonded crown, anything that's bonded, if you whiten your teeth, it reduces the bond strength. I contacted the Los Angeles Air Force Base, their dental clinic. I actually did not know they had a dental clinic, but I contacted my recruiter, my Navy recruiter, and he told me to call the Air Force Base. So I called the Air Force Base Dental Clinic, and since I'm in the Navy and am active duty, I can receive dental care there, which I don't know why I didn't know this. I just didn't look into it. But anyways, their dental clinic, of course, is also closed until June. So I will not be getting seen there since they're not opening until June anyways. But it was still nice to talk to a dentist that is in the military on the phone about what's going on with my tooth. He basically told me that we both think that it was probably the whitening strips that caused it to be sensitive. Thank you for listening to my TED Talk. Now let's get on with some yoga.
Settle in. With each inhale, pike your hips up.
Okay, oh my gosh, you guys. I was about to go to the grocery store and then I got a notification telling me that my package came, and I'm super excited. If you want to guess what it is, you can start guessing now. This is my first time ordering something like this through the mail, but I'm super duper excited. Okay, I'm gonna tell you what it is. I got a Monstera Adansonii, which is a type of plant. I hope I pronounced it right. I got a clipping of it through Etsy because the actual plant, like you get a full plant at a nursery, they're really expensive. Every time I've seen them at nurseries, they're like $80 for the plant, which is very expensive. So I decided to get a clipping. I've been wanting this plant. I think it's so cute. I'm kind of nervous because, but it seems, let's see how it looks. Oh my gosh, I'm so excited. Wow. Literally, I've been wanting this plant, but they're always so expensive. But these plants, once they grow, they'll like hang down and they look so pretty. Okay, I'm just gonna clean it up a little bit. I don't know if I should put it in water and let it grow or if I should put it directly into soil. I'm probably gonna open this up to see if the roots are long enough. If the roots aren't that long, I'm gonna let it propagate in water. But if they're pretty long, I might just put it straight into soil. I think what I'm going to do is cut a clipping here and try to water propagate this right here, because if I put all of this in soil, I think I'm only going to get one vine. And if I want a fuller plant, I might just need to propagate a little bit more. Alright, if you guys enjoyed watching this day in my life in quarantine video, please give it a thumbs up because it really helps out my channel. If you're not already subscribed, please subscribe and hit the notification bell. Alright, see you guys in the next video. Bye!